Welcome to Skinside Out, where we uncover the science, trends, and truths behind skin health. Your trusted guide to the world of dermatology. This podcast is for educational purposes only and is not a substitute for professional care by a doctor or other qualified medical professional.
Welcome to Skinside Out, where science meets beauty. I'm your host, Dr. Zain, with Courtney and Heather. So today we're going to be continuing our discussion on skin cancer awareness, talking about prevention.
So just to give you an overview, we'll talk about the importance of sunscreen. We will go into skin cancer prevention, the benefits of mole mapping, as well as different treatment options for skin cancer.
Yep, and skin cancer is definitely on the rise, so it's important to prevent this, which is easily preventable with the use of sunscreen.
Cool. So I think that we'll first go into the obvious preventative strategy, which is sunscreen. So let's talk about that, Courtney.
Yeah, so, I'm sure we all have used sunscreen at some point in our lives, and if you haven't, then shame on you. But why do we use sunscreen? Because the sun does emit harmful UV rays. So those rays can lead to cellular damage, which can lead to your skin cancers. Not only that from a skin cancer point of view, but it can also influence other diseases like rosacea, for example. It can flare that, or some people who just have sensitivity to the sun are, lupus patients, things like that. So sunscreen really is not only used medically for those conditions, but cosmetically, you want to make sure you're avoiding your fine lines and wrinkles, and it can help make you stay young.
What do they say? Like, nothing looks better in your 50s than wearing sunscreen in your 20s.
Yeah. So there are different types of ultraviolet radiation that the sun emits. So most commonly mainly there's UVA and UVB. So UVA is a type of UV ray that penetrates deeper, and it tends to lead to the premature aging and the fine lines and wrinkles. UVB is your classic or predominant sunburn UV radiation. Either of them can contribute to skin cancer, especially melanoma, which is the most serious type of skin cancer. So you definitely want to be protecting yourself from both.
Do you know how I used to differentiate between the two when I was studying for boards?
No.
UVB is, I always heard like B for burn.
And A for aging.
Yeah.
Smart.
So people think that UV radiation is only really harmful in the summertime when the sun's really strong, but that's not true. The sun is constantly emitting UV radiation, even in the winter months, even when it's cloudy. So sunscreen should essentially be worn all year long. And I tell my patients every single day, and they're always looking at me shocked, like, even in the winter?
Yeah.
Like, yes, in the winter. Even when you're driving, and you're even at working from home, UV light can penetrate through windows.
I love that when they say, oh, well, I don't leave the house. Okay, so you don't go grocery shopping, you don't go to the mailbox, you don't take walks.
Yeah. So, I think it's really important that you just make it a part of your routine, like you brush your teeth, to make it a habit, wear your sunscreen, SPF 30 or higher, and just call it a day. And you know that you're protected. And then just reapplying every 2 hours if you're going to be out in the sun for extended periods of time.
Yeah. And so, there are mineral-based sunscreens and chemical-based sunscreens, and we'll kind of touch on the difference between those. Typically, your mineral-based sunscreens are going to be your zinc oxide and titanium dioxide. These tend to be better, especially for more sensitive skin types, like those rosacea skin types or even acne skin type. They tend to protect better, especially ones that are tinted. I think we all are pretty good about using our tinted sunscreens, mineral-based more than the chemical sunscreens. Chemical sunscreens, I think, get a bad rep.
Do you think it's justified?
Yes and no. I think any sunscreen is better than no sunscreen.
That's right.
So in that regard, if you like your chemical sunscreen, I would rather my patients wear that than nothing.
Yeah.
It can be harmful to the reef. In Hawaii, it's actually banned to use any chemical sunscreen because the chemicals in there are destroying the reef. So those are the chemicals that are your avos and your oxys. Avobenzone, oxytonate, oxybenzone. So
octinoxate.
yeah, these are those chemicals that you know, I try to avoid just because I appreciate my coral reefs.
Yeah, and I think the biggest difference between mineral and chemical is their mechanism, so the way that they work. So mineral predominantly blocks UV rays from penetrating into the skin. Chemical-based sunscreens actually use that UV ray and converts it to heat and releases the
Yeah, it
heat.
absorbs those photons, that light energy.
Yeah. Now there's a little bit of, mineral sunscreens don't only block, they do absorb and convert a little bit. So there's a little bit of leeway, but predominantly minerals will block and chemical will absorb and convert to heat.
Yeah. And, some of the other benefits of those mineral sunscreens, we talked about, some patients who are more acne prone and rosacea prone, but also those that are really sensitive. I feel like there's less incidence of allergic contact dermatitis due to some of the ingredients. Controversial topic. What about the claims that they're hormone disruptors?
I shut it down. I hate that claim. I quote this study all the time because people come in and are so concerned. And I think also just the word chemical, people associate that with like bad chemicals. But everything's a chemical.
Yeah.
So when you look at that study, they were applying sunscreen, the chemical sunscreens, 7 times a day to the whole body. Now, who is applying sunscreen 7 times a day? No one. And every day, I mean, maybe if you're at the beach, you're applying 4 or 5 times, but every single day for, I can't remember how long the study, a year or something. So I think it's just ridiculous when it makes it seem worse than it is, I would say.
Yeah. And I think also the whole argument about the vitamin D deficiencies being caused by sunscreen. Okay, you can get vitamin D from your diet.
Take a supplement.
We know that UV light is a carcinogen. We know that it causes skin cancer. There's so many studies that have proven that. And then when you're trying to say that, like the vitamin deficiencies or, these chemicals are carcinogens themselves, I'm like, no, like that makes no sense. Like these arguments just drive me wild for why people want to avoid using sunscreen. It doesn't make any sense.
And then you get the people nowadays too that are replacing sunscreen with like coconut oil or beef tallow. Don't get me started. I just think it's so ridiculous. If you really care that much, I understand, but that's when you use your zinc oxide. It's used in babies for
like we put them on
rash.
babies' bottoms. I mean, it's got to be safe.
Yeah, how much more safe can you get?
Seriously.
So as long as you don't mind a little white cast, then wear the zinc oxide.
But hey, if you're worried about the white cast, there's micronized zinc oxide. Elegant formulations now. We're not in the 1960s anymore.
Yeah.
We can get a sheer sunscreen. And we have one that's in our office. It's incredible. I love it. It goes on completely cast-free. Like for me, like I previously did not want to use zinc-based sunscreens because it would make me look like this gray ghost, look really awkward. So I used to use more of the chemical sunscreen, but with the micronized zinc, I've completely changed. And I really like the way that it looks on my skin. I don't have the sensitivities, and I'm acne prone too, so it's a win-win.
Yeah, and for a long time too, I think there was this huge misconception that only fair-skinned people need to wear sunscreen, and part of that I blame, that zinc or maybe the lack of attention that these companies have put towards people of color, because of course people who have skin of color are not going to want to wear this white zinc that makes them look almost grayish or like ghost-like. So, not only fair-skinned people can benefit from sunscreen, both medically speaking and again, cosmetically speaking, when we think of other conditions.
That point reminds me of my journey with sunscreen. So I will admit, I did not use sunscreen at all until I was in residency. So until my mid-20s, I would just go outside, those were the days where kids actually went outside and played. So we would be outside all day. At
Okay,
the pool.
Grandpa.
Well, everyone, like all my pediatric patients are on their phones or like, they're playing like Minecraft or whatever, and they don't even play outside anymore. So, I would be going outside, playing sports, and never wore sunscreen. And I remember when I studied abroad in Europe, I went to Greece for a week. And I'm like, okay, whatever, it's just sunny like everywhere else. I got burned for the first time, and literally my skin turned so dark you could not tell the difference between my hair and my skin color. My eyes were like lighting up, my teeth were lighting up. I was burned. I'm like, I didn't think this was possible. So after that, I'm like, okay, so I can burn. And then when I got into residency and kind of really learned about the dangers of UV light exposure and skin cancer, and just also its effects on photoaging, that's when I started using sunscreen consistently. So it's never too late. And I wish I had known about sunscreen, but I thought that I was protected. Like my skin is darker. I don't burn really until I went to Greece.
Yeah.
So.
Yeah, I have a lot of my darker skin patients. In fact, I had one this week where she has some hyperpigmentation from old acne that she was experiencing. And when I told her that she should be wearing her daily sunscreen, she looked at me like I was crazy, and she said, "Why?" And I explained to her that even those pigmented spots can be influenced by the sun. So even from a cosmetic standpoint, it can be helpful to wear the sunscreen to help limit how long those spots stay around for.
Yeah.
And that's really important to a lot of people too. So
Yeah, and I think the cosmetic point is something that I hone in on with the younger patients. Like, you want to prevent wrinkles, sunspots. They kind of gravitate more to that. They're thinking about skin cancers like a lifetime away. It's not going to happen to them. Like, who cares? They're invincible.
Yep.
But when they're like talking about their looks and their appearance, then they kind of think about it.
They want to prevent that
Yeah.
as much as they can.
Yeah, and speaking of young people, I still cannot believe that I have seen patients who are still using tanning beds.
Yep.
So, talking about skin cancer prevention and how we can, really help eliminate that risk. The tanning beds drive me crazy. I can't even believe really that they're
It's
still
spring
legal.
break season. Everyone's trying to get their base
Yeah.
tans, getting
Yeah.
ready.
I
And
know.
it drives me crazy.
I see it all over TikTok, and the girl. I saw one girl. Her dad got her a tanning bed for her birthday, and I just if I could drill it into their heads, it increases your risk of skin cancer, specifically melanoma. We've had that patient who was, a longtime tanner and has had that melanoma. So it's not worth the risk. And that's why they make things like self-tanners now, where you can go get your nice glow.
Yeah, I'd much rather you go get tanning oil or tanning lotion or spray tan than to go to a tanning bed.
Yeah, and like they've come a long way. You're not going to look like an Oompa Loompa with some of these new formulations. So some of them look like really, really elegant, and you can't really tell.
Yeah. So another way to prevent that sun exposure, that skin damage, is limiting what hours you're outside. So of course, those peak hours, you always hear doctors and internet saying to avoid like between 10 and 2. Really just to avoid tanning in general, I think, is the key takeaway.
Yeah, I mean, I try to make sure that my kids are out playing, like, later on in the day when
Or in the shade.
In the shade, exactly. Wearing, sun protective clothing, that is huge.
Oh, yeah.
And that's something that I've embraced recently. I started wearing UPF clothing.
I love it.
I like it. It's so much
many of them.
easier.
They're cute now. It's not like back in the day,
But it's like so much easier.
It's
Like I don't
so
have to like have like I'm gonna put on sunscreen on my back.
Yeah.
And like it's cold.
Yeah.
I just put on a shirt and wear my hat.
And they're breathable too.
Yeah. I remember before I started in dermatology, I had taken a cruise with my parents, and we had went snorkeling, and I had applied my sunscreen, but you're out there for hours on the boat, and when you're snorkeling, your whole back is still exposed. And so of course I get back on the ship, and my whole back is burnt, and it was just a terrible feeling. Well, after that, the boat, I was a catamaran, they said that they had SPF shirts for sale. Of course, they were like $60, but
yeah.
I instantly bought one and I said, I will never go on another catamaran or go snorkeling again without my sun shirt because I just do not want to risk it.
Yeah.
Yeah, I think in addition to sun protection, it's important to incorporate healthy diet to help support your skin. So these are like diets rich in antioxidants like fruits and vegetables to help protect your skin from the inside out. Also, water plays a huge role. Drinking plenty of water, keeping your skin hydrated and elastic, and just overall keeping your skin healthy. There's a supplement that I love called HelioCare. Not sponsored, but I wish I was. It is actually an antioxidant derived from a fern. So it's called Polypodium leucotomus. And it really helps to protect the skin from harmful effects from radiation or any sort of damage.
Yeah. What about niacinamide?
Niacinamide's great. I think,
Yeah.
Systemic as well as
Yeah.
topical can help protect the
Yeah,
skin.
there have been studies with nicotinamide and how they've shown improvement in reducing actinic keratoses, which are precancers, and I think that's interesting and something that we talk about with our patients.
Yeah, and I think it's important to note that this is an adjunct treatment. I think sometimes people get the misconception that they can just take the HelioCare, but you still wear your sunscreen.
Yeah, there's no substitute for that.
Yeah.
And then let's not forget about getting your annual skin exams, making sure that you're getting screened from head to toe with a board certified dermatologist or a provider who is really skilled at looking at, these moles and other growths on the skin. So I think that's really important.
Yeah.
So with those skin checks, you might hear of the term mole mapping, which is something that is done to help kind of track the moles. So I'll let Dr. Zain speak a little bit on that.
Yeah, it's a great option for patients who tend to have a lot of moles, high risk skin cancers, and basically there are very high quality digital photographs that are taken to track changes amongst moles and other skin growths. And it's very helpful, especially with routine skin exams, reviewing that with what we're seeing on the patient in real time. And that has been helpful, especially when I was working in a melanoma clinic during residency. It was really helpful to detect some of those subtle changes between exams. And I think that can be a very valuable tool for patients who, either have melanoma, history of dysplastic nevi or atypical moles, or are just nervous and want that extra reassurance.
Yeah, and I think it's a game changer because it's not just taking photos of your skin. Like, you can do that at home. But this is really getting in and taking a magnified photo, something, like what we use with our dermatoscopes, so our little handheld magnifier tools, to help really see the structure of those moles and those lesions and to know if something is almost like microscopically changing.
Yeah, it's really like a visual diary of your moles, and which can be.
I like that.
Yeah.
Visual diary.
Yeah, poetic. But it's extremely important, especially when it comes to things like melanoma, because the earlier you're able to catch that, the much better that outcome is. And so I think that's where the mole mapping really shines in preventative care.
Yeah. Heather, who needs a skin check and how often should they be happening?
So I recommend skin checks annually for those who are over 20 for most people. I mean, you could span that out to maybe 25 or 30, but I think for most individuals, 20 is a good age, 18 to 20. There are some people obviously who have a strong family history of melanoma that might go a lot sooner for skin checks. Even skin of color or darker skin types, I do still recommend, depending on their risk, either an annual skin exam or maybe every 3 years, depending. But for most people, it's annual. Now, if you have a history of skin cancer, there's this kind of algorithm we go off of. So if you've had melanoma recently, you're likely getting skin checks every 3 months for at least 2 years. If you've had a basal cell carcinoma or squamous cell carcinoma, you're likely getting skin checks every 6 months for at least 2 years. And so it kind of depends on the person, but typically annually for most people.
Yeah, and it doesn't mean that you have to wait until your next exam if you
Right.
notice something new or suspicious. So if you are worried about something, just make sure you just call your dermatologist and, we'll see you right away and evaluate it. I think it's better to be cautious than, potentially have a skin cancer that can have devastating consequences.
Agreed. So what happens when you do have a skin cancer? How do we treat that?
So I think the good thing is if we detect it early, the cure rate is very high. So like Dr. Zain mentioned, anytime you do notice a spot that you're worried about, the sooner we evaluate it, the sooner we biopsy it, the better chance that we have.
Yeah, and the nice thing is many of these skin cancers can be cured surgically. So, your basal cells, your squamous cells, and melanomas, we often treat these with a surgical excision or Mohs micrographic surgery. So I'll explain what both of those are. So a surgical excision is where we cut out a skin cancer with prescribed margins to make sure that we are removing the skin cancer as well as a margin of normal skin so that we can ensure a high cure rate. That is sent to the pathologist to examine the margins to make sure that all the skin cancer has been removed. And that's, more for like basal cells, squamous cells, low risk tumors, and, also for melanomas. However, in higher risk areas or highly cosmetically sensitive areas, then I often recommend Mohs micrographic surgery. So Mohs surgery is actually a very specialized form of skin cancer treatment. It was named after Frederick Mohs, who was a surgeon. It's not mole surgery, it's Mohs surgery, MOHS. So basically what we do in the office is at the site of the biopsy, we mark the margins that we see clinically, and we try to take a small narrow margin around it and remove a small layer of skin. That tissue, it gets processed into frozen section slides in real time. So I have actually a histotechnologist who is preparing the slides for me, staining them. And then I serve as the pathologist as well. So I am looking under the microscope. I'm looking at the peripheral and deep margins of the tissue to see if there's any skin cancer there. If there is skin cancer at any of those margins, I carefully mark it on a map and go back and we repeat it again. And we take another small layer and very conservative therapy. However, if we're all clear at those margins, that means you're cured. So there is a 99% cure rate for Mohs surgery, and it's considered the gold standard. And it's especially helpful for high-risk tumors, such as on the face, things that are behaving a little bit more aggressively with a more aggressive histology. And it just provides us with the best cure rate with preserving the most amount of healthy tissue. So that's really important. So that's the first part. The second part is the reconstruction. So as a Mohs micrographic surgeon, I'm trained in plastic and reconstructive surgery techniques to help give you the best cosmetic and functional outcome the same day. So what we do is we go over the different options that you have. You can either leave the wound to heal in on its own. That's called second intent healing. We can do a linear repair where we're putting in 2 layers of sutures, internal, external, typically have a straight line. For more advanced or complex locations or sites or tumors, we may employ more advanced techniques such as a skin flap where we cut adjacent skin, rearrange the tissue so that it covers a defect while also having a good cosmetic outcome. We can also do a skin graft where we take skin from another part of the body, we remove it from there, and we actually sew it into place in the defect. So there are a lot of different options that we can use. And we can also use tissue substitutes as well to help promote healing. quickly. So there are a lot of different options that we have to reconstruct the tumors. And that's all happening the same day. So your Mohs surgeon is not only curing you of your skin cancer, but also putting you back together again.
I have a question for you.
Yeah.
What's your favorite type of reconstruction after Mohs?
I find flaps to be the
What
most
type
fun.
of flap?
My favorite flap. I love the O to Z flap because it
Yeah.
looks really cool and it makes a Z. And I love Z's.
Z-plasty.
Yeah, after me. So, but there's a lot of different cool flaps that are out there. There's a really cool one called the flip flop flap.
Oh,
Oh, I haven't heard of that one.
Yeah, so actually I wrote a little paper on that from a case that I did when I was in fellowship. So basically when you have a large defect involving the cartilage of the ear, like this part of the ear, like the concha and other parts, so you're essentially like have a through and through defect, you can actually take skin from behind the ear on the scalp, incise it, and actually sew it into place so that it forms like this little skin flap.
Like you pull it through.
You pull it through. It's a pull through flap.
Well, yeah.
So, and then later on, 3 weeks later, you kind of separate it, and that becomes part of your ear, and nobody sees the defect behind it because your ear's covering it.
So it's kind of like a graft, sort of, but
It's a flap. It's an interpolation flap.
Technically a flap.
Yeah, because it's still attached to the skin,
Oh,
but
I
then
see.
we separate it
Yeah.
weeks later. Kind of like the forehead flap, you separate it 3 weeks later once you connect it to the nose
Yeah.
from the forehead. So it's kind of fun.
Interesting. I like that.
And I think, a lot of people tend to be nervous about the Mohs surgeries or any surgery for that matter, because their biggest question is always, what is the scar going to look like? Yeah. And I think that's where Mohs shines because it is a tissue sparing procedure, and you are keeping intact the healthy skin. And if you're going to a provider that is both, cosmetically trained as well, I think that's always a nice situation for a patient who is worried about that cosmetic outcome as well.
And the nice thing is also we have all the technologies in our office. So being a comprehensive practice, practicing cosmetic dermatology, we have a lot of lasers and other devices that can help improve the appearance of scars, whether it's the redness. So we have a vascular laser that can help, or the texture where we can use like a CO2 to kind of blend it in, or microneedling. And we often, don't have to use these, thankfully, because our, reconstructions turn out really well. But if we need to, we have those tools available.
Yeah, and Mohs micrographic surgery is typically for skin cancer, non-melanoma skin cancers like basal cell and squamous cell. But there's also this term called slow Mohs, which we use for like melanoma sometimes, which is not technically Mohs, but it's where we're taking that specimen, we send it off to the pathologist, but we make sure the margins are clear before doing that reconstructive or any sort of simple closure.
It's called staged excision, and it is a great option, especially for practices that don't have immunostains. So immunostains can also be used, so you can technically do Mohs on some of these melanoma in situs, using these special stains, but not everyone has access to them. So large academic centers, they typically have access to it, but smaller offices often don't. So slow Mohs is the way to go.
I wanted to touch on some of the other procedures that people might hear of, or I know previous offices I've worked at have done some of these. So, for example, the ED&Cs, or some offices call them C&Ds.
Scrape and burn.
Scrape and burn, which stands for electrodesiccation and curettage. So that's a procedure that I know offices that I've previously worked at, the provider will numb the skin, similar to the biopsy, and they use this little curette to essentially scrape the skin cancer off, and then they use a device called the cautery to singe off that skin. So they do it usually about 3 times, kind of repeat that process, scrape and burn. And with that, it typically will leave this circular scar. Now, the problem with that procedure is that you're not biopsying or sending anything off to the pathologist to confirm that that skin cancer has been completely removed. So there is a higher risk of recurrence with that, and that's why you do want to be mindful of how you're treating those skin cancers.
And those aren't pretty scars.
No.
They're not.
I don't love an ED&C, but I will say the reason for the curettage is actually that skin cancer has a different feel when you're using that tool.
Feels
and
like
you're
butter,
doing,
right?
Yeah, you're doing that kind of scrape. It has a more buttery, smooth feel compared to normal skin. And so that kind of helps the provider know how far to go, but I still don't love it because you don't have that confirmation of clearance.
Yeah. I really always love having pathology confirmation.
Yeah.
Because I've seen such bad recurrences with patients who've been treated with EDNC, topical chemotherapy, and other methods, and these recurrences are horrible.
And they're harder to treat.
They're really hard to treat because there's scar tissue
Yeah.
involved, and then it just becomes a big mess. So I really like, tissue confirmation, like MOHS gives that to you. Wide local excisions give that to you. So I'm just not a huge fan of, these other options. And that also brings us to radiation.
Yep.
So, right, that is an option. It can have good outcomes, but I still don't know whether all the skin cancer has been treated.
Yeah.
I'm just hoping,
Yeah.
praying to God.
Yeah.
It's gone.
And there are also, like, especially for the advanced melanomas or invasive melanomas, there are other treatment options like immunotherapy, sentinel lymph node biopsies, which is where we're actually biopsying a lymph node to see if that melanoma has traveled to the lymphatic system. So there are definitely different options, chemotherapy, depending on what type of skin cancer you have and how advanced it is.
Yeah. So it's skin cancer, I think, if you haven't had it, most people know someone who has had a skin cancer. So, you're not alone in that realm. You have the support of your providers. There's so many resources online for people who have gone through things like that. I know for sure there's I talk about Reddit all the time, but there is like a Reddit group for people who have had melanoma. And so there's a lot of, I think, resources out there so that you don't feel like so afraid of what's going on and so nervous about your cancer.
Yeah, I mean, the AAD, ASDS, the Melanoma Research Foundation, American College of Mohs Surgery, they have great resources on their websites, all free.
Yeah.
So, I always encourage my patients to check it out. There's a wealth of knowledge there.
Yeah.
So I think that we had a great discussion about prevention as well as treatment. So some takeaways from today's discussion. Prevention is key. Wear your sunscreen, be smart, wear protective clothing, don't go out baking out in the sun, don't use tanning beds. And then just make sure that you get your annual skin checks. It's really important just have knowledge of what's going on with your body. And you can't see all of your body sometimes, and you just need a trained professional to take a look at it.
Yeah, and trying to avoid those the middle of the day, like between 10 and 2 or 10 and 4, some people say, wearing, like Dr. Zain said, the sun protective clothing, and also seeing your dermatology provider if you're worried about a spot. Maybe consider mole mapping.
Yeah, I mean, the skin is your largest organ, so it requires the most attention. So, things like the sunscreen, the sun protective clothing, your prevention is really going to make the biggest difference in deterring skin cancer overall. So,
yeah. Well, thanks for joining us and this month-long discussion on skin cancer awareness. I think it's a really important message to get out there. And if you have any questions, feel free to reach out to any of us. We're happy to answer any questions. Hopefully you like this episode. Please subscribe and like. And until next time, Skinside Out.
Thanks for listening. This episode of Skinside Out is complete. If you enjoyed today's episode, don't forget to subscribe, rate, and leave a review wherever you listen to your podcasts. For more tips, updates, and behind-the-scenes content, be sure to see what fun we're up to on TikTok. Follow us on Instagram and Facebook at Nor Dermatology and Aesthetics. Check us out online at norderm.com. Discover why our patients give us 5 stars on Google. Call us today at 919-617-0717